Thank you, doctors. Good morning, everyone. So today I'll be discussing two cases that were in Sheikh Shakhbout Medical City. First patient is a high-risk pregnancy in a maternal aortopathy. So clinical background of the patient. So basically, she is a 40-year-old woman with a diagnosis history of Marfan syndrome since she was 16 years of age, based on morphological features. She has findings of lens ectopia and aortic root dilation of 4.7 centimeters on echocardiography. And based on those morphological features, she was diagnosed with Marfan, and she was following up closely with an adult congenital heart disease clinic in her community in Dubai. Now, she was desiring pregnancy and following for preconception counseling. So she was found as high-risk pregnancy due to the underlying connective tissue disease, maternal age, and she was also having bilateral sacral meningocele with dural ectasia. So the plan for her was to proceed for open heart surgery and aortic root repair. So she underwent modified David's reimplantation procedure, in which they reimplanted her native aortic valve into an implantable aortic root. And she also underwent closure of patent foramen ovale and ligation of left atrial appendage with an AtriClip device. So her first echocardiogram post-procedure showed promising results with an aortic measurement of 3.6 centimeters of the mid-ascending aorta and aortic valve that is functioning well without significant regurgitation, dysfunction, or calcifications. Patient also developed mild pericardial effusion that resolved spontaneously and had sinus tachycardia, for which she was put on metoprolol. So eventually she got pregnant spontaneously with a singleton baby, and an echocardiographic monitoring was done throughout her pregnancy in each trimester. So the first echocardiography was done showing stable LV function and sizes, and the aortic diameters were also stable. Follow-up 1 month later of the echocardiography was still also showing reassuring results of stable aortic root size with no significant valvulopathies and normal ventricular sizes and ejection fraction. Genetics testing also was conducted in order to confirm the diagnosis and also to provide genetic counseling for the patient. And a pathogenic variant was identified in fibrillin 1 gene, which is associated with Marfan syndrome, and patient was found to have heterozygous mutation of this gene. Then after all the follow-up and workup with multidisciplinary teams with the obstetricians, neurosurgery, adult congenital heart disease specialist, and cardiology specialist, patients was followed up successfully during pregnancy. She was continued on beta blockers, and with close serial echocardiography for the mother and for the fetus, decision was made to proceed with cesarean delivery. As she is high risk, and she was referred to high risk anesthesia team. So elective cesarean section was conducted at 38 weeks of gestation, performed in Sheikh Shakhbout Medical City with a multidisciplinary team involved under general anesthesia, and that eventually went successful with very good results for the mother and the baby, and without any significant complications. So the learning points basically from this case that preconception counseling and planning is essential, especially in patients with connective tissue disease, and an indication for increased maternal risk is an aortic root of more than 4.5 centimeters, which prompted aortic valve replacement in her case. And multidisciplinary care is also important, and regular imaging and genetic confirmation guided the management in this situation. And this is just a reminder of the morphologic features of patients with marfanoid and the aortopathies that are associated with it. That's it for the first case. Thank you very much.